Hello, today's topic is about how laxatives work and their types. First of all, we have to understand what is a laxative. Laxatives are used to treat constipation by increasing the movement of the digested food via the large intestine. The logic is when the digested food travel quickly via the large intestine, less water is absorbed and as a result, the consistency of the stool is soft. That is the general idea of how laxatives work. There are few types of laxatives and we will go through each of them and their mechanism of action. The first type of laxatives are irritants and stimulants. In these group, the examples are senna, BISACODYL and castor oil. Senna is a stimulant laxative. Taken orally, senna causes evacuation of the bowels within 8 to 10 hours. It also causes water and electrolyte secretion into the bowel. In combination products with a docusate-containing stool softener, it is useful in treating opioid-induced constipation. Next in this group is BISACODYL. BISACODYL is a potent stimulant of the colon. It acts directly on nerve fibers in the mucosa of the colon. However, the side effects are abdominal cramps and the potential for a tonic colon with prolonged use. Doctors must warn the patients not to take BISACODYL with milk, proton pump inhibitor and antacids, as this will increase the gastric juice secretion and cause irritation and cramps. The last in this group is castor oil. Castor oil is broken down to ricinoleic acid, which is very irritating to stomach and promptly increases peristalsis. Doctors should not give castor oil to pregnant patients because it may stimulate uterine contractions. The next group is bulk laxatives. Examples in this group are methylcellulose, psyllium seeds, and bran. They have the same mechanism of action. Bulk laxatives include hydrophilic colloids, which is from indigestible parts of fruits and vegetables. They form gels in the large intestine, causing water retention and intestinal distension, thereby increasing peristaltic activity. Bulk laxatives must be used cautiously in immobile patients because of the potential to cause intestinal obstruction. The third group is saline and osmotic laxatives. Saline laxatives, such as magnesium citrate, magnesium hydroxide, and sodium phosphate, are non-absorbable salts that hold water in the intestine by osmosis. This distends the bowel, increasing intestinal activity and producing defecation in a few hours. The other example is lactulose, which is a semisynthetic disaccharide sugar that also acts as an osmotic laxative. It is a product that cannot be hydrolyzed by intestinal enzymes. Oral doses are degraded in the colon by colonic bacteria into lactic, formic, and acetic acids. This increases osmotic pressure, causing fluid accumulation, colon distension, soft stools, and ultimately defecation. The next group are known as stool softeners or emollient laxatives. These medicines are surface-active agents that become emulsified with the stool, produce softer feces and ease passage. Examples include docusate sodium, docusate calcium, and docusate potassium. Doctors must warn their patients that these drugs may take days to become effective and are often used for prophylaxis rather than acute treatment. The next group are lubricants. Examples include mineral oil and glycerin. They act by facilitating the passage of hard stools. However, mineral oils cannot be taken with stool softeners. What is the reason? Comment your answers below. The last group is chloride channel activators. In this group, lubiprostone is an example. It works by activating chloride channels to increase fluid secretion in the intestinal lumen. This eases the passage of stools and causes little change in electrolyte balances. As usual, there are quiz questions. Pause this video and answer them. Comment your answers below. As usual, please like, comment and subscribe if you find this video useful, as this will motivate me into doing more videos like this. Don't forget you can request your biology or medicine topics via the Google form that is linked in the description below. Thank you and see you all in the next video.